My name is Paul Ferguson and my nickname is PF. Ever since elementary school, I didn't have friends, so having a nickname for the first time felt good. The one who gave me the nickname was the tallest boy in the class, Bob Davis. I assumed he simply used my initials as my nickname.
PF is like a play on your initials, you know?
Bob was smirking. Was there something funny?
And poker face is like you can't even read the room and smile.
For some reason, Bob was angry now. You can't read a room. It's not something that's made of words. So, how can anyone read the room? So, isn't everyone here someone who can't read the room? I couldn't understand what he meant. Not knowing what to do, I forced a smile. People say I usually look expressionless. My mom always tells me to smile because I look angry when I'm quiet. But it's hard to smile when there's nothing funny. So, I end up forcing a half smile.
This guy's grinning even after being insulted.
Now, Bob burst out laughing loudly. He's really expressive. Then, Rebecca Smith entered the classroom. Bob and his friends who had just been pointing and laughing at me suddenly stopped.
Good morning, Paul.
Rebecca was the only classmate who treated me normally. By normal, I mean saying good morning when you meet someone you know in the morning and not forcing a laugh when there's nothing funny. She looks at me just like one would look at a flower on the side of the road, without forcing any smiles. Good morning, Smith. With her, I knew I just had to respond the way she did, and it was easy. Smith, I have a question. Bob called me a poker face who can't read the room. Rebecca faced me and listened intently.
Yes, I suppose a poker face can be seen as someone who's arrogant or unemotional, and therefore can't read the room.
Her explanation was logical and easy to understand. But I thought since a room isn't made of words, you can't read it, so what does it mean? I knew Rebecca would give a clear answer, so I asked.
Can't read the room doesn't refer to the room as a physical entity. It means someone who can't gauge the mood or atmosphere of a situation.
That makes sense. I knew what poker face meant, but I wasn't good with idioms like can't read the room, so Rebecca's explanation helped. Thanks, now I get it. When I thanked Rebecca, she nodded.
You're welcome.
She then sat down and began reading her book. I indeed have difficulty gauging what others are thinking. I'm also not good at expressing my thoughts through my face. So, the nickname PF might suit me perfectly. I have to admit, Bob is pretty clever, I thought to myself. From then on, until graduation, Bob and his friends called me PF with a chuckle, but now that I understood the origin, I simply responded with yeah. I was reminiscing about those middle school days. Today, I'm meeting those old classmates after a long time. Years have passed since then, and I've grown up a bit. I now understand that being called by the nickname PF was derogatory towards me. But I don't get upset about it. That's because it's true that I'm someone who can tread the room. Better, less idiomatic descriptions might include communicate on disorder or socially oblivious. After 12 years since high school graduation, a reunion is set to take place as I turn 30. The entire grade, along with our class teacher from back then, had rented out a hotel banquet hall for a grand gathering. Having checked the box for attending on the RSVP postcard, I am now standing in line at the reception. Being extremely bad at remembering faces and names, it felt refreshing as every person I met seemed like a stranger rather than a familiar face. I attended a public middle school in my residential area. Students from 2 elementary schools within the same district came there. With 5 classes in our grade and close to 200 students, there were probably some students I had never met. There were a few like Bob whom I remembered because we were in the same class for all 3 years. But I wasn't confident in recognizing them since their faces might have changed as they grew up. So, the feeling was almost like meeting my classmates for the first time, and I was super nervous. The continuous feeling of meeting strangers was too overwhelming for me, and I was already a bit tired just at the reception. Being anxious about going to crowded places, I had consulted with her beforehand. She said, "Let's go together," so I decided to attend. Looking around the reception, it didn't seem like she had arrived yet. I thought if she was by my side, this uneasy feeling would lessen a bit. She mentioned recently that he's been busy with work, so she might be coming in after working on her day off. The main topic of conversation between classmates meeting after a long time is usually, "What have you been up to?" Answering, "I'm attending a reunion," when asked, "What have you been up to?" is clearly not the right response. I've at least learned that much after becoming an adult. In the context of a reunion, it basically means, "What's your current job?" Following her advice, I decided to keep my real job a secret. She told me that being honest would be troublesome, so I planned to dodge the question.
What are you up to these days?
Before I knew it, Bob, who had somehow spotted me, stood right in front of me. I hadn't seen Bob since middle school, but he looked unmistakably like his old self, so I recognized him immediately. Before I could respond, Bob spoke again.
PF, you're probably a bum, aren't you?
It was that old nickname again. Bob might not even remember my real name since he always used to call me by that nickname. "I'm working, just a regular office job," hoping that would deflect any further questions.
What's regular for you might not be regular for the rest of us.
But Bob, with a smug grin, kept pressing. I've always struggled with reading people's expressions, but Bob's facial movements were exaggerated and easy to understand. This smirk hasn't changed since our middle school days. I now realize he's mocking me, but that doesn't make me angry. At that moment, I noticed some commotion near the reception.
Is everything okay?
Someone shouted.
It seems Rebecca fainted.
Word spread quickly to the far end of the room where we were standing.
That Rebecca Smith fainted,
Exclaimed Bob, rushing towards the entrance. I followed close behind. A circle of people had formed around the fallen Rebecca, with everyone in a state of panic. But everyone was just standing back and watching. A few were barely calling out, "Rebecca, are you okay? Can you hear us?" However, no one attempted any immediate first aid measures, like lifting her up, checking her breathing, or checking her pulse. It can sometimes be best not to move someone, so I understand the hesitation.
Call an ambulance.
I stopped Bob, who was shouting loudly despite having a phone himself. "I'll check on her." I assessed Rebecca's condition. She was conscious and could answer questions properly. It seemed she might have fainted from anemia, so I felt somewhat relieved. Hearing from those around her, she had been walking unsteadily and then suddenly crouched down before lying on the ground. Given the situation, it's unlikely she fainted or hit her head. I've always been out of the loop when it comes to gossip since high school, but I later heard that Rebecca was considered the most beautiful girl in our grade and was out of everyone's league. She has a presence that draws people's attention, so she's always the center of focus. That's why so many people could describe every move she made from the moment she appeared at the reunion until she collapsed. Overall, I think it's reasonable to assume she fainted from lack of sleep or overworking. Still, it might be best to take her to the hospital just in case. Please call a cab. I asked a hotel staff member who had come after hearing the commotion. Taking a moment to breathe, suddenly words were being thrown my way.
Who the hell are you?
Bob exclaimed with an exaggerated tone. A different kind of murmur rose from the circle that had surrounded Rebecca. What's going on? Paul's always been odd, right? Isn't he that PF guy? Various voices were heard. To people I hadn't met since middle school, me examining a sick person probably seemed strange. I have a medical license. I explained succinctly about why I examined her.
No way? There's no way an airhead like you could be a doctor.
Bob sure has a loud voice. He did mention he works in construction, so maybe raising his voice is the norm for him.
He is a doctor.
Rebecca, still pale, informed the crowd. It's good to hear that her voice was a bit stronger than before when she could barely whisper.
The taxi has arrived.
A hotel staff hurriedly informed us. With the assistance of 2 female staff members supporting Rebecca on either side, she was able to get into the taxi. I accompanied her to the hospital, just to be safe. I left the buzzing classmates behind. Later on, Bob visited the research facility where I work. It seems he found out about my workplace after speaking to Rebecca, who he assumed was in the know. For the record, she works as a medical clerk at a local hospital. Rebecca, who was a celebrity during our middle school days, now seems to be the talk of the hospital. She's often at the reception, making her easy for anyone to approach. Currently, I'm a researcher at a genetic research institute affiliated with a university hospital. Though I acquired a medical license, I wasn't cut out for clinical work, so I pursued a research career. I explained all this to Bob, who had visited me during my lunch break. Unlike his behavior in middle school or at the reunion, he listened without any jest. In fact, it was Rebecca who inspired me to become a doctor. Her father, who is now retired, was a doctor. He was a professor at a major university hospital. And Rebecca herself had always admired her father and wanted to become a doctor. That's why she had a decent amount of medical knowledge. She realized that I wasn't just an oddball who couldn't tread the room. It was hard for people to notice because I didn't have an intellectual disability, but I was on the ASD spectrum. In terms of types of developmental disorders, it would be equivalent to Asperger's syndrome. That's the reason for my poor communication skills. Even though my parents felt I was difficult to raise when I was a child, they never suspected a developmental disorder. Or maybe they purposely turned a blind eye. I heard later on that during regular health checks, a nurse had hinted, why not try a developmental test? But my parents, both with high educational backgrounds, were too proud and thought, not our child. They apparently declined the test. They were probably too trapped by the term disorder and had an aversion to it. During a standard IQ test in kindergarten, I had a high IQ. When I started elementary school, no one suggested I should be in a special education class because I didn't show signs of ADHD like inattention or hyperactivity. Developmental disorders like mine tend to be overlooked. But in reality, due to my lack of communication skills, I often didn't fit in well with the regular class and faced a lot of troubles. While I found it hard to understand others' feelings, both good and bad, I never felt bullied or hurt. But I did feel out of place. I remember feeling a sense of discomfort between myself and others while going through school. The person who reached out to help me was Rebecca. Thanks to her talking to her father, Professor Smith explained it all to my parents, and I ended up seeing a specialist. I remember feeling relieved when I got a diagnosis for my characteristics. I had always felt a difference between me and others, but now that there was a name for this feeling, everything made sense. From there, our families started to get closer. If I had been in the same elementary school as Rebecca, I might have gotten medical attention and therapy much earlier. But meeting in middle school was still a blessing. If I hadn't met her, my ASD would have probably remained unnoticed. Being diagnosed as an adult would have made it even harder for me to adapt to society. I'm grateful to have been guided by Professor Smith. When I finished telling my story, Bob bowed his head.
I'm sorry for making fun of you by calling you PF. I'll try to understand developmental disorders better.
I always knew Bob was sincere, so I never got mad at his comments. But I hoped that with his sincerity, he would be more understanding towards people with developmental disorders in the future. The reason I decided not to be a clinician during my residency was because I struggled with communicating with patients. Taking medical histories is essential, and it was very stressful for me to continue doing something I'm not good at. That's why I decided to pursue the genetic research believed to cause Asperger's syndrome. Professor Smith, my mentor, guided me through this path. My close relationship with Rebecca and the professor continues to this day. Today, I was invited to Professor Smith's house and enjoyed a meal made by his wife and Rebecca.
I'd like you to take over my research, and would you consider having my daughter?
Professor Smith said this as I was enjoying the delicious food. Since being diagnosed with ASD, and thanks to the support of the hospitals and specialized institutions I've been to, I think I've gotten better at understanding others. But I'm still not good at distinguishing whether someone is joking or being serious. I respect Professor Smith and want to continue researching his field, but Rebecca is Professor Smith's daughter, not a possession. It's not right for Professor Smith to give her to me or for me to take her. I do understand that he means marriage, but marrying me, she's bound to face challenges. Rebecca understands me well and is the easiest person for me to be around. However, I think it's best for someone like me to stay single, focus on work, and live at my own pace.
Dad, saying would you consider having my daughter is disrespectful to both Paul and me.
I agreed with her, but then she said,
I had every intention of properly confessing my feelings to Paul, but doing it in front of my parents is just the worst possible situation.
I was surprised by Rebecca's unexpected remark. However, both Professor Smith and his wife laughed upon hearing her statement. Well then, we shall leave you two young ones alone, said Professor Smith, as he and his wife went out for a walk. Suddenly, it was just the two of us. I could feel my heart pounding. It seems I'm quite nervous.
I had wanted to become a doctor too, but I gave up. I really admire how you've used his unique qualities to excel as a doctor.
For my part, I deeply respected Smith for her ability to treat everyone equally.
If being with me would be a burden, you don't have to consider me as family. But I'd like to be by your side, even if just as friends.
Smith expressed her feelings. She sees my traits not as a negative but as uniqueness. Being someone who struggles to understand others' feelings, I might not truly grow to understand her. However, when I'm with her, everything feels peaceful. It'll probably be tough being with someone like me, I said with a straight face before hastily trying to smile. Shoot, not good. You should smile. When you're silent, you look mad. My mom always told me when I was little, so I added an awkward smile.
You really can't smile for the life of you, can you?
Smith laughed heartily after looking at my stiff expression.
I don't think I'd mind the challenges. It's fun being with you.
I wonder if I emulated her smile, I'd get better at it.
Is being with me a pain?
I shook my head in response.
Then, can we hold hands the next time we're done with work?
Seeing her genuinely look shy was a first for me. She might be trying to convey her emotions to me more vividly with her expressions. I'm not sure what our relationship will evolve into, but I do understand that she's someone I should cherish forever.